Hey, Pusnet, a little video again in the self-reliance series. This one will be short, and it's just because I don't really want to talk about all the thing in one, and actually we'll have two components of it. The first one is just to do kind of a follow-up on the one that I've been doing for medication, and I'll put a link down. It's a PDF that I found, and it's kind of a book. So, Galen used to be a doctor in the Roman time, and all the way up to about the 1500s, 1600s, his writings has basically influenced Western medicine. And up to even almost in the 1700s and 1800s, they were still doing some of the medication that they were talking about for him and everything. Obviously, his writing was a little bit off. For example, in our veins, he thought that we had air, not blood. But anyway, this a bit. A lot of his name, kind of, because it has such an impact on Western medicine. So the book that I'm reading right now, and I'm going to put the link on with this PDF, is on Galenic pharmacology. And basically they're talking about how to make medication back in those times. And also I'll do a little bit more once I have more knowledge. I'm going to start a course on herbology and how to mix herbs and things like that. So I'm going to try to learn a little bit more about that. But I thought it would be interesting for some people that are interested in that kind of stuff, because if you would be in self-reliance, you would have to probably start relying on how to make your own meds and everything. Again, I'm not saying, like make your own antibiotics or things like that, but just to even have the information in the back of your mind is kind of interesting. And the series on self-reliance, I will do more on medication and everything. But one that I wanted to talk about was this one on, Galenic, what they call Galenic pharmacology. And the second one is that a lot of people, they limit themselves to pills or or IV. There's different ways of taking medication, and actually I'll put also the link of the course that I'm actually right now kind of reviewing. It's a pharmacology course, but it's very well done, and the reason I'm doing it is so that I see if I would recommend it to people, and it's good revision. You can always review that kind of stuff, but they go really in details on how drugs goes, the metabolism of drugs, and what's the metabolism of drugs, and it's pretty well done. I mean, even if you're not a healthcare professional or anything, it is done for actually non-healthcare professionals, so it is relatively well. It is actually well explained in plain English, if we can say that, so that you can understand how when you take a pill or anything else, how does it work. And the first thing that you need that a lot of people don't quite seem to know is that there's a lot of ways of giving medication. There's not only just pills, and actually pills, even if it's more common, is because it's cheaper to do, but it's for the metabolism of the body. It's harder to come out with a pill, because first of all it has to go through the stomach, which has a high acidity, low pH. I mean, the stuff that you make in your stomach to digest your food, if you would put that on your clothes, it would literally burn your clothes. It would put a hole through your clothes. This is how bad and acid that stuff is in your stomach. So now imagine if you're putting pills and a protein or something like this into your body, and this stuff attacks. So they have to come with a compound that would be able to be absorbed. The second thing is that it has to do what they call the first pass. And so basically what it does is that when it's absorbed through your GI tract, so your gastrointestinal tract, it goes through your livers, and then it will be changed in metabolites and everything. Don't want to go too much in pharmacology, because I mean, there's a whole course, and I think it's like 6 or 10 weeks, that course. So that's kind of to go more into detail about it. But the first pass, you can lose a lot of your medication and efficiency of your medication because of that. But there's a lot of other ways of giving medication. Sublingual, so one under the tongue. So for example, the old bottles of nitros, that's how you administer it. So either you do a push under the tongue, or you put a little pills and you let it melt. Those are sublingual. Those bypass the first pass systems. They go into your system more directly, and they're easier to make in some compound. The second one is another one too, is rectal. And I know this sounds disgusting and everything, but there's a good absorption through the rectal. So they're either in suppository, or there's other medication, or sometimes you can even inject, but you need like a special thing. But there is way that you can administer the medication and everything. There's obviously what we call parenteral, so that means that subcutaneous, intramuscular, IVs, all are other ways of giving. Why am I talking about all those ways? Is that when you choose some stuff on self-reliance, think about the material that you will need. So for example, in the hospital, in emergency, we pretty much use all the route of IV. We don't even give a lot of intramuscular. We rarely even give subcutaneous. The reason we're doing that is because we want an effective medication right away. Boom, give that, easy to titrate. And again, bypass the whole pills, and we don't want to wait for. We're very impatient people in emergency. But if you have a patient that comes in pain now, he doesn't want to have the pain to be removed in about 30 or 40 minutes. He wants the pain to be removed now. So by giving intravenous, we can do. But we're in a closed environment. We have the supplies. Because you start intravenous pretty much on a constant daily, like 5 or 6 of them, you get very good at it. Also, a lot of time we start intravenous because we need to draw blood. So anyway, we need to poke the skin, so might as well put intravenous in. So this is what the convenience of intravenous is. But in the self-reliance medicine situation, or outside the hospital situation, intravenous is not the greatest way of administering stuff. First of all, you need to carry all the supplies to start your intravenous. Second of all, now you have increased, every time that you're going to break skin or for anything, you increase the risk of infection. And if you're outside in limited resource situation, you do not want infection, because then they're harder to deal with. And the second of all, too, you will use your supplies. So you'll use your supplies of antibiotic. You'll use your supply of if you have a wound now of wounds. So because you'll use different supplies just because of something you did. Because everything we do, it's always like I was talking before, risk or benefits. So medication-wise, I would recommend the Promout. But the problem is that if you have an unconscious patient, then it becomes difficult to manage. Or if you have someone that is a little bit like drowsy or something like this, then it's a little bit different. But don't forget that there's one under the tongue that you can use. And again, it has to be in a special formula, but when you're going to choose medication, think about that. And there's intrarectal as well. So for example, over-the-counter Gravel can be bought in rectal stuff. So if you're vomiting your guts out, but you need something to take care of your nausea, put a rectal. And that will decrease your nausea and maybe your vomiting as well. But now, or if somebody has a fever or something like this, then you can also sometimes you can find those, especially like for kids, giving a pill is if you're a parent, you know how bad it is to give it. Well, that's why we give it intrarectal sometime in the hospital, because it's easier, it's the same absorption, and actually bypass the stomach. So a pill is not superior in any way to a suppository or a sublingual. It's a different formulation, and actually sometimes it's even less effective. It's just because of the first how rapidly it goes through your system, and as well as doing that first pass. So the reason I'm talking about this is that when you prepare or when you look at medication or over-the-counter medication, talk to the pharmacist or something else to see if there's other ways you can give. Because another way also you can give, if you cannot give it straight to the mouth, you can put a tube into the nose and inject. So there's different ways of giving medication. And personally, I would stay away from syringe and IVs and everything because of the risk of introduction to infection. And then if there is infection, all the supplies that you're going to have to use to try to treat that infection is supplies that you, in limited resource, could have been used to something else, and especially that you created the situation. So try to avoid those situations. So the second part of it, of the video that I wanted to talk, so it was more a follow-up for the medication, but the second part that I wanted to do is that, I'll show you over here there. So I was and I kind of did this to myself. So I'm a little bit off commission for the rest of the summer, but it brought me to questions that and I thought I was going to do a full, because when I initially did like that step approach, I was going to do like a checkmark list, and then I thought of that list is so huge and it's so personal that I think it's not really a thing to do for me, but bring the idea for you to sit down with the people that you will be in a situation of survival, self-reliance, and discuss and see that list and what you're going to do. So what list are we talking about? We'll call special people. So if you have, for example, right now, let's say my plan would be to bug out, and that's my survival plan and everything. With this, won't happen because now I'm limited in the way that I can walk or where I can walk and everything like this. So my situation now dictates me to change my plan. So that means that, for example, if I was going to, let's say, like for example, when Katrina hit, a lot of people was trying to go to family or whatever. Well, now maybe I'm pushed to go to one of those stadiums and everything because I need care. And in the disaster communities now, they're more aware, especially from Katrina, especially with people with special needs. So we're talking about chronic disease like COPD, asthma, elderly people, people with decreased mobilization, autistic kids, or autistic people, not just kids, but pediatrics. All those are specialized. They need special care. And when you're going to do your plan, I would urge you to sit down, see the kind of people that would be around you. And if anybody has those kind of disease, so like CHF, heart problems, diabetes, or anything like this, start asking yourself the question, what would I do if we need to leave the premise of my house? So, because one of the things you may have to do is separate. So, for example, if my plan was to bug out, unless I'm able to bring myself all the way up to let's say you were going to bug up to a cabin, maybe I can be to the cabin. But if you are going to walk in the mountains, then I cannot do that. Then your plan should be to be closer to medical resource. So basically go with what the authorities would be providing, or even separate your groups. So if you have someone, for example, that needs oxygen and you cannot provide that oxygen because for whatever reason you have to leave your house or something like this, then those special groups, that will be part of the plan. You'll have to separate your group and say, okay, well, we'll bring you to the shelter and we'll do our plans that we had initially. So, like I said, there's so many variables in this that the best way would be for urging you to kind of sit down, considering that in the back of your head, and come out with your own tick and list, and to see coming up with a plan. Talk to you soon.